Hello, I'm going to do my video blog on attention deficit hyperactivity disorder, more commonly known as ADHD. We just learned about this in class recently and I thought it was really interesting. I do agree it's probably one of the most controversial mental disorders out there. I think it is misdiagnosed. I think it is overdiagnosed and mistreated many of the time, especially among students. So ADHD is basically where there's dysfunction in inattention and hyperactivity disorder. So inattention could be described as impulsivity, impatience, blurting out, not being able to wait someone's turn. Hyperactivity described as like being squeamish, nonstop talking, touching, playing, just being really, really active. And ADHD is actually, it could be either or, so you could have inattention or you could have hyperactivity, but I think many of the cases it's probably both, a problem with both. It occurs in students, like I mentioned earlier, so probably around the age of 5 to 17 would be around the onset, and that's probably due to the fact that students are more in a larger environment, and some of the symptoms are probably easier to point out as opposed to the earlier years. ADHD has a few causes. There is a genetic link, so oftentimes if your mother or father have ADHD, it's been shown to show up in the child as well. It's been linked to chromosome 16, according to our lecture in class. It has to do with issues in the frontal lobe, and it's treated with stimulants and behavioral therapies. So medications would be including stimulants, non-stimulants, antidepressants, but most of the time I think it is treated with stimulants. You can use behavioral therapy, so that would be like behavior modification, reinforcement schedules, self-management, and you can actually use a combination of both. So those are just a few quick facts on ADHD. Thanks for watching.